Hemi-neglect is a common symptom encountered in clinical practice. Let's make it simple to understand. This is an impaired attention disorder to one side of the hemisphere. It is usually caused by lesions on the right hemisphere. This is because the right hemisphere controls the bilateral hemispace, while the left hemisphere only controls the right hemispace. Now, hemi-neglect can be of sensory type. So in sensory hemi-neglect, which can be of the spatial type, whereby a patient cannot recognize the left side. This can be tested simply on the bedside by a line bisection test. So, in patients who are normal, they'll bisect the line centrally. In patients who are having hemi-neglect, they usually bisect the line more towards the right side. However, in patients who are more homonymous hemianopia, they usually bisect the line more towards the left side. This is because they make up for the loss of vision on the left side. Another simple test usually is a clock drawing test. So all patients with hemi-neglect on the left side will tend to accumulate all the numbers on this side. Sometimes this can be associated with dressing apraxia, whereby the patients do not dress or do not shave or do not comb the left side of their body. Sometimes we can have motor hemi-neglect. This is whereby patients do not move the left side or they have impersistence. So in motor impersistence, if you ask the patient to raise their left hand for 20 seconds, they won't be able to do it. However, they'll raise it for a few seconds. This denotes that the lesions are more towards the ventral side, especially the frontal lobe. Now, in those patients who are having motivational hemi-neglect, sometimes this is also known as emotional neglect. The cingulate gyrus is the one which is more involved. And in this kind of patients, the lesions are localizing towards the right cingulate gyrus. Sensitive tests for hemi-neglect includes the double simultaneous simulation. Therefore, not all patients will show overt signs, and therefore, double simultaneous simulation is a useful test. What you do is you provide usually an auditory stimulus. So an auditory stimulus is given to the patient, some on one side and then on both sides. Ask the patient where the stimulus is coming from, and they'll usually ignore the stimulus which is coming from the left side. This is simple to do. Now, in clinical practice, so in patients with posterior cortical atrophy, which is closely linked with Alzheimer's disease, these patients show neglect because they may have asymmetrical right hemispheric atrophy. The right hemisphere is more atrophied than the left. Cortical basal syndrome, again, this is an asymmetric symptom. And these patients who have right hemispheric atrophy usually will present with neglect of the left side. Importantly now, in patients with Alzheimer's disease, they do have kind of memory loss called topographical memory loss. So in patients with Alzheimer's disease who have topographical memory loss, usually their parahippocampal area is affected. And especially in those patients with right parahippocampal area, which is more atrophied, they will develop memory loss associated with their surroundings. And this is all about hemi-neglect syndromes in clinical neurology.